The corners of my eyes are droopy. This recently started happening at the end of last year when I was tired, and now it is 24/7, gradually getting worse. I have no idea what it is. Can I get this fixed? A few people have pointed it out, and it's embarrassing.
Thank you for your question, and thank you for submitting the photos, which are very helpful to describe the concern you have. So you've submitted a question about a progressive drooping of the lower eyelid, and clearly from the photo we actually see a clear separation away from the eye that is consistent with your concern. So since I'm not able to tell clearly exactly the age, your age from the photo, I can just share with you a little bit about the causes of loosening of the lower eyelid. First of all, it is common for someone who, as we get older, for the lower eyelid tone to get a little stretchier or softer, and the eyelid begins to sag. Now that is intrinsic. Basically, a lot of things get loose with age, and so very often with people who are, let's say, in their 40s or 50s and older, we have to do some type of tightening procedure when we do lower eyelid surgery. Now, if you're younger and you've developed this problem, essentially, in my experience practicing oculofacial plastic surgery for 20 years, a lot of times for younger people, it's related to allergies, eye rubbing. Basically, chronic rubbing of the eyelid can cause some stretching and loosening. Even people who wear contact lenses, who are typically pulling their eyelid down to manipulate and place their lenses and remove their lenses, they can get some loosening. Now, the first thing to do, I would suggest, is to meet with an eyelid specialist, like an oculofacial plastic surgeon, just to be sure that there is no other systemic issue. We want to be sure that the muscle tone and everything is just not indicative of some other problem, which is of relatively low likelihood, but it's important to be checked out. Once you've eliminated any other systemic problem, then the repair of this type of problem in my practice is fairly straightforward. Essentially, what I find most of the time is there is a loosening of a structure called the lateral canthal tendon. And when that tendon gets loose, what we do is we do a procedure where that tendon, which was previously firmly attached to the inner aspect of the bone, has to be somehow reattached. Now, in most situations, we do something called a lateral tarsal strip, where we attach the eyelid and reattach it to the internal aspect of the bone using some fine sutures that, once it's placed there, it heals and it lasts a long, long time. So I think the solution for you is relatively straightforward from a surgical perspective, but I would advise just seeing someone with a lot of experience with eyelids who understands ophthalmology as well, just to be sure that everything else is okay, and also to have an understanding of what your final results will be and the long-term benefits, and if there's any other management issue related to allergies or something of that nature, then you can manage that as well. So I hope that was helpful, and thank you for your question.